Hi, everyone. Welcome to tonight's Med Mentor Monday on interview advice. This is part 2 on MMIs and group interviews. Today, we have some great panelists who are current med students at DGSOM, and we're all a part of Med Mentors, which is an organization that was started a couple years ago where we provide free advice and resources to all pre-med students, regardless of whether you're at UCLA or another institution. So please visit our website to take advantage of all those great resources. And we'll be answering a lot of your frequently asked questions at the end of this session too. So stay on and feel free to put questions in the Q&A that we can respond to throughout the session or save for the end. So we're going to get started with some introductions. If we want to start with Jennifer, you can just say your name, your year, where you're from, and your undergrad.
All right. Hello, everyone. I hope you guys are all doing well. My name is Jennifer. I grew up in LA. I went to undergrad at UC Berkeley. I graduated in 2018, and I am now an MS2 at DGSOM. Am I missing anything, Julia?
Okay, that's great. Maria, do you want to go next?
Sure. Hello, everyone. My name is Maria, currently an MS1, so just starting here. Let's see. I went to Brown University, but graduated way back in 2016, so I'm a bit more of on the non-trad side. Also got into DGSOM as a reapplicant, and I have experience with both in-person and virtual interviews because of that.
Hi, everybody. My name is Kate. I am originally from Salt Lake City, Utah, and I went to Occidental College in Los Angeles and took 4 years off before coming back to LA to go to DGSOM. I am on a leave of absence, so I recently finished my 3rd year of medical school, and I am taking a year for research.
Great. Thank you all for coming tonight. So we're going to get started by giving an overview of what an MMI is, if you've never heard of one, and how you might kind of encounter these in a virtual setting too. So can you guys just start with anyone can talk about what an MMI is and what it even stands for?
I can get started. So an MMI, it basically stands for mini multiple interviews. And the way that they're structured usually is that you have like a couple different scenarios. They're usually about 3 to 5 minutes, sometimes a little bit longer, depending on what school you're interviewing at. And they'll basically ask you a question that's sometimes more on the controversial side, or could be a little more thought-provoking. And you basically just go from like room to room. I also did this virtually, so it was a little bit different, but that's kind of what the structure of what an MMI looks like.
Great. And so how did you guys prepare for MMIs?
For me, I did a couple of practice scenarios, like I found a generator online. Because usually, even with the MMI, you'll still get some traditional questions mixed in there. Not all of them are always like these ethical or controversial. Sometimes you'll get something a little kind of out of left field, like if you could direct a movie, what movie would you direct? It's like not everything is going to be like you have a Jehovah's Witness and they need a blood transfusion. But yeah, so I just like with a fellow pre-med and a sister, I just practiced a little bit like that, just because to get the timing down. Because you'll usually have like anywhere between like 1 to 2 minutes to read like a little prompt that gives you what that scenario is. And then you'll have the additional anywhere between like 3 to like 7 minutes to actually like either talk it out or role play or, work with a group. There's like a lot of different kinds.
Yeah, I did end up like buying a book on Amazon about MMIs that I thought was helpful, but I also think you can find similar resources just online for free. And one thing that I thought was helpful is it had some scenarios where they had sample answers that they kind of broke down into like the different components of the answer and why like that answer worked. And for me personally, it was helpful just to kind of see some examples of like how you might go about answering some of those trickier questions. And even though you're going to be, you're representing yourself, you're going to be stating your own opinions, it can be helpful to see like what are the strategies that people use to kind of structure and communicate the answer that they're giving to those questions. So I found that helpful. And then, slowly starting to find some example ones to practice on my own once I'd seen some examples that were, deemed to be good answers to those questions.
Great, thank you. And can you guys talk about a little bit about what it is like doing a virtual MMI for those who experience that, since a lot of this year's interviews will be virtual? Is it in breakout rooms? Like, do you stay in the same room? Does the interviewer stay in the same room? Like multiple Zoom links? How do you navigate that?
I honestly don't remember too many of the details behind it. And I think it was more school specific, but a lot of times they had like your agenda set out. And from my experience, I think it was different links that you would click on. And there was also like different times where you would come back for that specific meeting.
I concur with Jennifer. Also, again, school specific. So sometimes what they would do too is they would have you in a breakout room and then they would assign you to a group to do specific, in my case, I'm thinking like a role play scenario, like they had us all together, then they separated that out with like our quote unquote standardized patient that we would talk to.
And then a related kind of logistical question, but did you guys ever use notes when you were in your interviews? Are you like allowed to write things down, especially since it's virtual? I feel like we were talking in the earlier session where people had notes up. Like, what is it? What are your thoughts on that?
At least for me, when I was, when we had like the 1 to 2 minutes to read, you were allowed to, like take notes. So for me, that was helpful, like just to like write down a couple of things to be like, okay, this is kind of like what I want to hit, what I want to talk about. So I can have something just quickly like glance at if I need to. Because I don't think there was a case where they told us, at least with the few that I did, that we were specifically not allowed to use that anyways when we were at our interview.
Great. So I guess we will transition into like talking about how to approach these questions, because that is something that a lot of people here want to know. So what are some frequently asked questions that you kind of experience with an MMI, and how did you address those questions? And we can kind of go by theme. So with MMIs, one of the big ones is ethical scenarios. So like Maria was talking about, maybe someone who is a Jehovah's Witness needs a blood transfusion, but their religion prevents them from getting that. And they might change it in many different ways, where maybe the patient wants it and a family member doesn't, or vice versa. In general, how do you address ethical scenarios, and what's your structure for answering those types of questions?
I think for ethical scenarios, it's important, first of all, to usually at the beginning, I would try to like kind of restate the scenario in my own words and just kind of to start off with, make sure that I was understanding the question correctly. And then from there, I do think it's important to be able to communicate that that you can see maybe both sides of an issue. So you can see like what the conflict would be. And be able to kind of state, I would sort of try to put myself in the shoes of both like sides of whatever the argument was. And so I would kind of do that second after restating the question. And then ultimately for many of these questions, they do want you to kind of have a somewhat of a firm position on what you think the right course of action would be in that situation. And so then I would explain, this is what I would do in that situation, or this is what I think is the best course of action. And then be ready to kind of, if they have any follow-up questions about that, be ready to kind of defend why you feel that having taken into account both sides of, or all the different angles that you might approach this question from, that this is what you think is the most ethical way to address the situation.
I think another it's the important thing is like how you do your reasoning and kind of how you walk the interview through your reasoning allowed them to see like what your thoughts are, why you're picking the side you're picking, but while also acknowledging the opposing side potentially. So I think that's like an important thing. Like, don't necessarily think like, oh my gosh, there's only one right answer, and if I can't figure it out in like the 2 minutes that I'm reading this prompt, then I'm in trouble. No, it's like it's okay to have an answer, or even if you're not sure about what your answer would be, just like talking out your thought process and like logically laying it out and saying this is why I think this or that, or this is the other information that maybe I'm missing that's not in the prompt that I would want to know, and that could help inform my decision one way or another.
Yeah, I also definitely agree with everything that Kate and Maria have said. I think for me, one of the most important things was at the very beginning, like say it was something that was, I think an example that I can think of at the top of my head was you have a lab partner that's failing anatomy. How are you going to approach a situation? What are you going to do? And so I feel like, for example, for something like that, I would always start off by trying to show like empathy and feelings, right? So like, before I did anything, I would say like, oh, this is a very difficult situation, and I'm sure that, blah, blah, blah. But like you want to express emotion that you feel empathy for that situation. And then if possible, what I would also try to do is give an example of something similar. So I remember for that specific scenario, I talked about having difficulty in lab myself when I was an undergrad and how I felt and some things that I felt I could have benefited from. So I think whenever you can, if possible, sometimes it may not be appropriate, but when appropriate, giving examples of when you've been in similar situations, I think could be helpful because that could explain the reasoning as to how Maria was talking about as well.
Another thing too that was helpful for me is just thinking about like principles in ethics. So sometimes I would bring that up because when I was interviewing, I was actually taking an ethics class, but things like patient autonomy, the right for the patient to choose their own decision, you can always bring things like that up. You don't have to sound super fancy in your logic, but it helped me think through ethical scenarios. Another one is like beneficence, which is, helping the patient versus what's called non-maleficence, which is like do no harm. So you can always kind of look at those principles in ethics to try to direct you in your argument. But at the same time, you don't have to be like super fancy with the language or say those words during your interview. It just helped me. Okay, so another popular question is something that has to do with like your character development. So some examples are like, tell us about a time you made a mistake, or what's your greatest weakness. I didn't get a lot of those with MMIs, but sometimes it comes up and it definitely comes up in individual interviews too. So you guys have any suggestions for how to approach that type of question?
I mean, I think with these questions, like at least the sense that I get is that they're looking for self-reflection and like for you to be able to sort of reflect back on something that you've done in the past, or some element to yourself that maybe like isn't your strongest character trait. And so I think that the way that you present it is very important. And there are certainly ways to acknowledge that, we all have flaws. We all have things that we don't love about ourselves, or things that we've done that we wish we hadn't done, or ways that we've handled things that we maybe could have done it better in hindsight. And so I think what they're looking for, is for you to like give a genuine example. So not like, a weakness that's actually a strength. But it's okay to admit that you have weaknesses or that you've made mistakes in these character questions. I think what's important is that then the reflection on, okay, what do I do to, like, what am I actively doing now to make sure I don't make the same mistake again, or like, how has this changed the way that I approach things, or what are some ways that I've been working on this particular character trait of mine. So when you get asked questions that are negative in that sense, or like asking you about a mistake, or as Julia said, a negative, like a character trait, I think that's the way that I approached it, at least, was just by trying to be like very self-reflective in my answer, of acknowledging that trait and then discussing, what are some ways that I actively work on myself to address that.
All right, and then another type of common, I guess, challenge that you'll see in MMIs, which I definitely had when my interviews were in person. I'm not so sure, I'm curious to hear what it's like in virtual settings, but like assessing teamwork. Did you guys have any like teamwork things in the virtual setting, or was that less common?
At least for me, I don't think I ever really experienced anything where I was like working with another student. Yeah, I don't think so.
Yeah, I don't think I can recall in any other ones I've done virtually. I know like when we were in person, I did have a team building activity, but not virtually.
Yeah, I guess we can touch on it briefly just in case someone is going to a school that has a in-person MMI. But at least when I did it, there was one room in the MMI where we basically were building like a Lego set, but one person was looking at the instructions and one person was building the actual Lego set. And so, you couldn't see like what the other person was doing. And so you kind of had to like, the person looking at the instructions had to tell the other person how to build the Lego set step by step. And then that person had to build it by listening to them. It was kind of weird. There was another one where like we were in teams and we had to build these like marshmallow towers out of like pretzel sticks. It's so bizarre. I interviewed way back. So me and Kate interviewed at the same time. Maybe it's for the best that you're not doing that anymore, but I guess I'll save my tips for the end because I want to hear yours. Like, Kate, what is your advice for those teamwork scenarios? And like, what should you not do in those scenarios too?
Yeah, I also got a fair number of these teamwork scenarios, and some of them were like quite ridiculous and always interesting. I think for these, at least the way that I had some that were me and another student who was also interviewing, and then some that were like me and just the interviewer themselves, where I was like describing to them how to build something, but they couldn't see what I was doing. I would say the biggest way that I would approach these is like, whatever the task is, like having like very frequent check-ins, because what they're looking for to a great extent is how you communicate with other people. And so, if I'm describing to someone how to draw something or how to build something out of Legos, stopping pretty frequently and being like, okay, like, can you describe to me what you're looking at? Like, tell me like what you're seeing and what's exactly in front of you right now. And so having these kind of check-ins throughout the activity, and then just being aware that like, it's okay if it doesn't work out perfectly, or if the structure you end up building doesn't look exactly like it's supposed to, because at the end, there would usually be sort of a little debrief where they would ask you like, how do you think that went? Like, how do you think you communicated with each other? And if this was done in the context of you working with another interviewee, this probably goes without saying, but you definitely want to be complimentary of the other interviewee. You don't want to say anything bad about the other person that you're interviewing with. But they're also just looking for you to reflect on like, oh, like I realized when I said this, that was confusing to them. And maybe this is why it didn't look exactly the way it was supposed to. So just again, that sort of self-reflection and being able to look back on your performance and say, oh, in hindsight, this is what I might have done better. And this is what I could do better next time. And then finally, just making sure that you don't ever want to get like frustrated, I think, in those situations, because sometimes it can feel frustrating. But you just, I don't know, if you keep a good attitude about it and just treat it as a game almost, then I think, having that sort of attitude towards it goes a long way. Because you will encounter setbacks in medicine. They want to see that, that you deal with frustration with grace.
Yeah, one thing I'll add too is like, I think sometimes they're just looking to see if they can figure out who is like very competitive, because you don't really want that in a med school classmate. I mean, all of us are intrinsically competitive in our own ways because we're pre-meds, but like, if you get so mad that your marshmallow tower doesn't win, like that's kind of a red flag. Like you don't want a doctor like that. And I've seen people like that in interviews. They get so visibly upset. And so they're almost like trying to push people to their limits just to see. So just stay calm, cool, collected, and know that, you can build a marshmallow tower another time and it'll be fine. So, okay. I guess since I've been out of it a little bit, Jennifer, Maria, do you guys have any other like frequently asked questions that you remember getting in MMIs that you have tips for, or even if it's just a general theme?
I don't know if just depending on like the schools I went to, but it can vary greatly. Like some schools will definitely seem to have like a theme. Like I remember one where like, I mean, it might be telling by saying this, but a lot of the questions had to do with common problems in the Inland Empire, for example. So kind of like knowing, what issues might be relevant to that particular school and community can be important. But again, otherwise, sometimes it'll be like a good mixture of just like seemingly random, non-clinical questions, and then others that seem to be a bit more targeted. So just kind of, be open and flexible with your thinking and creativity, and definitely using your own lived experiences helps a lot if you can, use those as your examples for your reasoning for a lot of these things.
Yeah, I think also to add on to that, I feel like it's really dependent on kind of the school. Sometimes it's very tailored specific to the school. But other times I feel like it's just very like all over the place. I think that one thing that caught me off guard was maybe being a little bit more on top of current events. I feel like I got really locked into like the application and the cycle that I wasn't always keeping up with the news sometimes. And like I remember I had one specific interview where they asked me about something very specific that had happened like that week on the news, and I was like, what is that? So you definitely don't want to be kind of in a situation like that. But yeah, I think just staying on top of like current events could be something that's helpful too.
Yeah, that's a great point. Something I forgot they ask about too. Same with like healthcare policy. I'd seen some online questions about that. I never got any of those, but I also didn't have that many MMIs. So yeah, were there any resources you all used? Like I know Kate talked about a book she had. But like, were there any other useful resources that you remember using during that time to prep and find maybe information that you should know, I guess?
Yeah, I'm not sure if Kate and I are talking about the same book, but I definitely used I wrote it down here. It's called MMI Winning Strategies. And I feel like so it gives you like a very specific structure of how to answer questions. I feel like for me, that was helpful in just making sure that I didn't miss any information, or even when I got nervous, I kind of had a go-to of like, okay, I'm going to start off with this, then I'm going to talk about this. So I felt like that was very helpful. And also I think since it's probably going to be virtual, what I did was just like record myself on my laptop to see kind of like, am I looking down too often? Am I like looking out into space? So just little things like that to like kind of see like what are habits that I'm doing that might not come off as well.
Yeah, I definitely concur with the recording yourself. That is very helpful, especially so you can see, yeah, like how you're looking at the camera, how you're talking. Do you have any nervous tics that you're not aware of that you're doing, like overly touching the glasses, the face, or something? I think it also helps for me. I liked listening to a lot of Dr. Gray stuff of the medical school headquarters. He has like the website, the YouTube podcast. So I listened to some of his like specific MMI ones. And I thought those were helpful.
All right, and we've been talking a lot about MMIs, but I don't want to forget about group interviews, even though, again, I'm not sure how often those happen in the virtual setting, but in case you run into one, there's like I would consider two types of group interviews. There's what's called like a panel interview where you are interviewed by more than one interviewer at a time. So I remember at one school it was like me in a room and then 3 people interviewing me, and that can be very intimidating. And so what advice do you guys have if you're ever in that setting in a panel? And then we'll talk about group interviews too.
I had a panel interview for I think 2 schools. I think the main thing for that one was knowing your time limit and knowing it well and what it feels like, because for both of the schools, we had 6 questions, and one school I got interviewed by 2, another by 3 interviewers. But I noticed like the first one I did, I ended up having too much time at the end because I was worried that I wasn't gonna have enough time, so I kept my answers shorter than they needed to be. So by the end of those 20 minutes that I had maybe 7 minutes left. So then it was a little awkward, like, okay, now I have to come up with so many questions to ask them because I can't just, sit in silence or leave early. But then I used that experience and I was much more prepared for the other one. So I timed myself and paced myself well. So even though the same number of questions, at the end I only had like 2 or 3 minutes left, and that was much more reasonable to then ask just like a question or 2 and then get an answer.
And then what about for group interviews? So for those who don't know, a group interview is like, I don't know, one interviewer. It could be more than one interviewer, but then it's like you and a couple other applicants at the same time. So they might ask like Maria a question and she'll answer, and then they'll ask Kate either the same question or a different question. It can kind of be weird to know what to do in those situations. What are your tips to like stay engaged, and also, I don't know, do you acknowledge the other person's answers? Like, how do you interact with people?
I only had one of these interviews. In that one interview, I did think that there was certainly, I noticed that there was a tendency of maybe 1 or 2 students to really like dominate the conversation. And I would say you probably want to fall into the middle category of students. Like, you obviously want to respond to the questions that are asked to you, but you don't want to be talking over other students. And I would certainly, like, I think it's good to, I mean, you don't have to necessarily verbally acknowledge what the responses the other students are getting, but like, look engaged, like, look like you're interested in what they're saying. Like, you don't just have to sit there and, stare at the interviewer, but, I think it's always good to have some sort of acknowledgement for your fellow interviewees.
All right, we'll move to the next part now, interview do's and don'ts. So these can be specific to MMIs or group interviews. They can also just be general tips for interviewing, and especially in a virtual setting. If you guys have any practical tips for Zoom, please share those.
I think my best advice is just, keep your cool, stay calm. As hard as it's going to be, try not to get nervous. I feel like it goes a long way to just really, stay composed and think more clearly. And if something unexpected happens and something doesn't go well, also just try your best to just keep your calm. I remember I had an interview where like my internet connection went out, and I was they took me out of the Zoom, and so then I had to wait 5 minutes to get back in. So I missed 2 of my scheduled MMIs, and it was disastrous in my head, I felt at the time. But it actually allowed me to have a closer connection with the dean and speak to them more. So it kind of ended up working out in another way, which was nice. And I still got accepted to that school. So, sometimes things happen that are out of your control, and that's okay. Just try to keep it cool.
going off of that too, I would say for MMIs, I at least had a couple like individual interviews where it seemed like from speaking to the other students afterwards that maybe it was designed to kind of stress you out a little bit, or where like the interviewer was very like stone faced and not responsive to like anything that I was saying, or was like very like challenging everything that I was saying. And those, like, I remember coming out of those and feeling like really terrible about myself. And then speaking to other students afterwards and realizing that they had a similar experience with that same interviewer. And so I would say for MMIs, like, just take a moment in between them to kind of reset yourself and just like take a deep breath, because I would say there was not a single like full set of MMIs that I did where I felt good about every single one of them. Like, it's okay. Like, it's okay to not be perfect. And it's okay if you have one or two stations where you feel like you didn't do as good of a job. Because in part, like, that's what they're for. You get these different opportunities to speak to different people. And, you know, so just don't let that one interview carry over into the next one. So just take a moment to kind of recenter yourself and take a deep breath and go into the next one just with that behind you.
I completely agree. And also I think something we forgot to mention, but yeah, usually you'll have like 10 or even 12 of these different stations. So that gives you a plenty of opportunities. So it's like, if you feel like, oh my gosh, I really feel like I bombed this one or even 2 or 3, that's okay, because then you have plenty of other ones, you know, to really show your stuff. And it's true, because you're not going to know everything about everything, and you're not expected to. The important thing is that they want to see what your thought process is. How do you keep yourself calm, cool, collected? Especially because, yeah, I've also encountered that where you get very stoic or very challenging interviewers, where it seems like they're like, yeah, purposely trying to push your buttons or like, you know, trigger something, but it's like you just gotta always stay calm and collected. And also just in practical terms, like if you know ahead of time that you are, like, for me, I lived in a place with like bad internet connection. So I like reached out, like, you know, a couple of months before interview season to a family friend, like, hey, can I, you know, go ahead and, you know, borrow a room in your house to do my interviews in when the time comes? Because I know virtually I wouldn't be able to do them at my own home. And luckily she said yes. So it's like, that's other things you want to look for, little logistics, want to make sure, you know, your camera and audio is working well, your computer is going to handle it, and all those kinds of things.
All right, now we have time really to answer questions. We have a lot of time. So we already got some questions submitted, which are really good and reminding me of other important things that we should have talked about. So one is there time allowed for back and forth with your interviewer during an MMI? You know, are they going to ask follow-up questions, or should you expect to use the entire time with your initial response?
I think it does depend on the school sometimes, because I think I remember there was one specific where they like flat out told us, like, at each of these MMIs, you know, what you say is basically what you're gonna do. You're not gonna, don't expect your interviewer to like use up any of your time or ask you anything else. Whereas others, it's like very much they will, you know, you can say one thing and then they'll completely throw you another question. It's like, okay, but what if we like tweak this scenario just a little bit? Now, how would you respond?
Yeah, I think I realized the second question is about that too. So yeah, you have 2 minutes to read the scenario, and if you have 8 minutes to respond, I guess just school dependent, like Maria said. And no, I'm not sure we know for specific schools. Sorry about that. Maybe we can help in the chat. But all right. And then I guess another question, how do you guys deal with just like interview anxiety, especially before the first interview? Like, how did you kind of give yourself a pep talk or calm down before a stressful time?
I think for me, this is where I just really tried to prepare as much as I could. so that I felt like, if I just really got so nervous, I had practiced so many times that if I just did something similar to what I practiced, it would be fine. And also I know myself well, and so like I didn't try to do anything dramatically different that day. Um, I have a friend actually who was like interviewing last cycle, and she's like, oh, I made the mistake of like adding like 2 extra cups of coffee, and she was like jittery and like her eyes were twitching. So like don't do anything crazy like that. Um, let me see what else. And yeah, I think, like kind of like everybody's been saying, like you should just be confident in yourself. If they've invited you out for an interview, it's because they want to learn more about you. And I think that in itself is something to be very proud of. And like you have to go in there and share your story and shine, and you'll be fine.
I think it's also good just always to remember too that the people interviewing you are just people. And I think with traditional interviews, sometimes it's a little bit easier because you maybe have more of a chance to have a conversation with the person. And I think for me, at least, that helps me like feel more calm, as just kind of treat it like a conversation, because MMIs are more like formalized format. It's harder to do that. But yeah, just remind yourself that like these are just people, and they are just as interested, like they want to have good students in their class, and like they're excited to meet you. And at the end of the day, they're just interested in getting to know you. They're not, here to try and, make your life more stressful. And so I think that was for me just helpful to remind myself.
Okay, we have another question. What should we include in thank you letters for MMIs, especially if the interviewer didn't really discuss anything personal? And did you even send thank you letters for MMIs?
Okay, I'll be honest. I never sent any thank you letter, and I turned out fine. So, and I mean, some of it is school specific, because you have to be careful, because some schools will definitely tell you we do not want any other communication from you, including thank you letters after you've done your interview. Anything you send to us will be completely disregarded. So do be careful about that. I don't know if it's changed, but I'm thinking specifically of Keck. They were very adamant about like, don't send us anything, like we don't need that information. What you've done up till now, that's what you get, basically.
Yeah, I think thank you letters make more sense if it's like an interview or individual interview where you were talking to the person for like 30 minutes. Maybe it's a faculty member, you probably have their name and you can find their email. But again, if it's like something very quick where you didn't even know the person's name going in, don't feel pressure to send a thank you email or find those people out. One approach is you can always like send a thank you email to like the head of admissions or the person who was like sending you the schedule and stuff. But again, it's school dependent. Sometimes schools say don't send us anything. So make sure you look at those rules too. Okay, we got another logistical question. Who actually is interviewing you in MMIs? Is it med students? Is it faculty? Is it both? What is your experience with that?
I personally have never been interviewed in MMI by a medical student. It usually tends to be like faculty from my experience.
I don't know if this has changed with virtual interviews, but I have had MMIs done by medical students. At UCLA, I actually had a medical student who did one of my MMI rounds. But mostly it was faculty, and I'm not sure how that's changed with the virtual format.
Yeah, I think it might depend on the school, because I think I had like a mixture depending on the school, whether it was like all faculty, or sometimes they had like a couple of community members mixed in there. And in the case of one school, well, when this was in person, they actually had like their actual standardized patients. Like they introduced them and used them as part of their MMI for the role playing scenarios.
Oh yeah, maybe we should talk about that because I never encountered that. But if that's happening, what is a role-playing scenario like? How do you approach them?
Yeah, so for one school that I interviewed at, it was very interesting and a little stressful because the way they had it is you had only 1 minute to read the prompt, the scenario of what it was, and then you just had 5 minutes to role play it. And you were expected to stay role playing during those entire 5 minutes. Luckily, they did give you like a little like Zoom like warning at the top of the screen so you can see when you had like 1 minute left. So that kind of helped you time yourself. But otherwise, they can kind of be random because I had some where they were like clinical based, like, oh, you know, you're working at a doctor's office and you're going to have a video call with a patient about the COVID vaccine. Or some other one was just completely more of a just like random, like, oh, you're a coworker for a store, but you know, this the past month your coworker hasn't been coming in on time. So now you're gonna video chat with her, you know, and how do you respond basically? So it's just kind of like being yourself, being empathetic, you know, being nice, being understanding, and trying to be open, not immediately like trying to like judge or put labels, because sometimes, you know, they'll throw in things in that scenario that might make you think one way, but it's just like, you know, asking open-ended questions and just like getting to know in that short time you have who this other person is and trying to see their point of view and potentially helping them come to some sort of a anything, whatever the scenario is asking you to kind of get at, where it's like help or advice or something.
All right, it looks like we might actually end up early in this session, which is nice for those of us who've been around since the first part. Let's just finish off with some words of encouragement to all of these future med students here listening who are about to start their interviews or maybe have already started them. What would you have told yourself before that big time?
I think again, I would just say, you know, keep your cool, stay strong, and you've made it really far. You're almost there, and just share your story and share your personality.
Yeah, this is a very stressful process. Like even however many 4 years later, like I still remember how stressed out I was. So make sure that you're also taking care of yourself and like talk to your friends, talk to your family, like I don't know, get yourself a Starbucks after your interview or whatever it is that you do to like unwind. But this is a very stressful process, unfortunately. And I think many of us have come away from interviews feeling like we didn't do as great of a job as we could have. And honestly, in some cases, I think we're not always the best judges of our own performance. And so it may be that you did much better than you think. But if you're ever feeling that way, just know that you're not alone and that, as Jennifer said, like you've made it really far and you belong here and you were invited to interview for a reason. So
I completely agree with everything Kate and Jennifer said. I will also say this might be a little silly, but sometimes one school's secondaries is another school's interview question. So keep that in mind. Like if you work so hard on writing all of these secondaries, sometimes they're gonna come back at some point or another. So you can always like, so you're already like generating examples, because at the end of the day, it's like sharing your story. That's what's most important. So like think of all these scenarios that you've already been through in your whole life and kind of how they can reflect in the questions you get asked. And yeah, just relax. You've got this. If you gotten this far, you know, you'll be okay.
Yes. And on that note, thank you all for coming. Please note that Med Mentors is going to be having 2 mock interview days that you can sign up for free. I believe some of the people in this room might be interviewing you if you sign up for those. So those will be on September 24th and October, oh, I already forgot, October 8th, I think. But follow us on Instagram, Facebook, Twitter to stay up to date on how to sign up for that. It'll be first come, first serve, open to anyone. So if you need some MMI practice, we'll be doing that. You can also always sign up for a practice MMI through our peer advising program, and all those details are in the agenda and can be found on our website as well. So thank you all so much for coming tonight, and have a great rest of your week.